Hello, my name is Dr. James Song. I'm from Frontier Dermatology, and I want to discuss with you a condition called generalized pustular psoriasis, also known as GPP. This is one of the few conditions that we treat in dermatology that we consider to be an emergency, right? So these are patients that often have to get hospitalized because they're so sick. I mean, these patients have a widespread kind of erythema studded with pustules, and because their skin barrier is compromised, they have a high risk of infection as well as organ failure, especially from their liver, the kidney, the lungs, and their heart. And so we finally have a medication that was actually developed to target that dysregulated cytokine pathway, which is interleukin 36. And this is a medicine called Spesolimab. And even with a single IV dose of Spesolimab, when you look at the clinical trial data, over half of these patients got the complete resolution of their pustules. And we haven't seen that with really any other therapy, right? But in addition to that, we need to remember that GPP is a chronic disease where many of these patients will go on to have recurrent flares or even persistent disease. And so in the same way with plaque psoriasis, where we need to keep people on long-term maintenance therapies, it's the same thing with these GPP patients as well. And just from having treated several of these patients in my own clinic, one of the biggest concerns that our patients will have about GPP is when that flare is going to happen. It's just a fear of the unknown, and they're just really, really anxious, when that flare is going to happen. So just having a medicine to use as more preventative of flares or maintenance therapy is going to be really important. And the good news is that we now have Spesolimab not only as an IV dose, that's for the induction, but also as a sub-Q maintenance dose every 4 weeks to dramatically lower the likelihood of these patients flaring. Now, when you think about GPP, we don't just consider this to be a skin disorder, but truly is a systemic disorder where patients not only have the skin findings, but they have systemic findings like fatigue and pain. Over a third of these patients will actually have joint pain as well. And then oftentimes they will have abnormal lab changes as well. So there's a high burden of systemic inflammation. And that makes sense mechanistically when you think about these cytokine pathways that are dysregulated in GPP, unlike plaque psoriasis, which is primarily an IL-23 Th17 driven disease. GPP is mostly due to an IL-36 signaling pathway. And we know that IL-36 has an important role in the innate immunity, so it can attract these neutrophils as well as other immune cells that are going to really increase these inflammatory markers, which is why these patients often feel acutely systemically sick, right? So again, think about GPP both as an acute disease. You want to get those flares to go down quickly. We got an IV dose of Spesolimab that can do that. And then eventually you want to transition them to maintenance therapy with a subcutaneous Spesolimab to really make sure we keep these flares from happening.